Yeah, what I was gonna say is I actually don't like. I'm not like in love with this setup, bro, because I don't know the palm tree in the background and stuff. It's just not my style.
Well, I mean, greenery, greenery sets off some good vibes, gives good energy. You
Yeah,
know, it's like you got greenery all across like a whole bunch of living spaces and business spaces. So I was kind of feeling it.
yeah,
It's a good backdrop too.
yeah. You want to do something similar?
Yeah, I've always wanted to start a podcast for the longest time, but it's kind of just been like, in terms of like the actual setup when it comes to like mics and how to record it, edit it, distribute it. That's where I'm like, I don't know.
Oh man, I need to put you in touch with my guys then, bro.
Yeah, that'd be great.
To help you out.
That'd be great. Yeah, because I'm starting to see like a lot more podcasts come out, like local podcasts,
Yeah.
and it's super cool. And like just listening to people talk, it's like, man, like the Valley has some pretty cool people.
Yeah.
I think the majority of us kind of tend to think that you got to go elsewhere, you got to go outside of the Valley. But I've always been in love with the Valley since I was a kid. I never wanted to leave. I always wanted to stay here. This was home. I was like, Valley's gonna grow, man. Valley's gonna grow, and it's growing.
Me too. And I feel like I don't know if it's just because I live here, because I have that mindset, or if it's actually true, but I feel like the Valley has always like historically had kind of like a closed mindset, especially towards things like entrepreneurship. And it seems like we're the last ones to like, if there's a trend or whatever, it seems like we're the last ones to experience it and stuff.
Yeah.
And I feel like in general, people in the Valley are, and maybe it's the older generation too, but kind of closed-minded. Kind of close, but I feel that's shifting. I feel that's changing, and there are a lot of people that are out there doing stuff. There's like girls starting cosmetic lines and like being very entrepreneur, and a lot of people are giving support to that and stuff. So hopefully that crab mentality. You ever heard that?
Yeah,
Crab mentality, where
for sure. Yeah, and I think the Valley kind of is always last to get trends, like from music to fashion to even healthcare and everything. Like we're the last to get all these things, and I think closed-minded in a sense. Yes, I think I used to have that, like I would label it as being closed-minded. What I would say now is I think like my parents' generation and their parents' generation kind of like I think there was a lot of small business. There's probably more. I don't know. I feel like maybe small business was kind of a thing back then too, but it was more along like, just got to provide food, got to provide shelter, got to provide transportation, and just like on those core basic necessities. And I think that now that's given the platform to people like yourself, like myself, and all the others that you're talking about. We're like, now we can try to make small business into a bigger business and impact more people throughout the
you know what?
community.
That's a good point. I think you're making a good point there, because they're like more conservative,
Yeah.
but more conservative for a good reason.
Yeah.
And I feel like nowadays this generation is less conservative, but we're less conservative for different reasons. I think we're less conservative, and we're more willing to take risk because out of I want to say a little bit of it is necessity, because you got runaway inflation, rampant inflation, and so I don't think we live in the days of our parents where it's like, hey, mom could get a job, dad could get a job, 2 incomes, and we'll be all right.
Yeah.
It's kind of not like that. I know a lot of families right now that they have 2 incomes and they're still like, oh man, we're like barely making it. We have 2 teachers at home and like we're like barely making it.
For sure.
And so I think the generation now growing up, seeing that, realizing that, now experiencing that, going out into college or whatever, and then paying so high prices for something, they're already seeing the writing on the wall where they're like, man, I got to start doing something different. I need to find entrepreneurial ways to create multiple streams and this and that. So, because yeah, I speak with my aunts and my uncles and my cousins too, and they talk about how their mom is and stuff. And I'm like, man, they grew up in a different generation. Like my uncle, for example, he grew up poor. And he had 12 siblings. He was like the 5th one born or something like that, and he's very conservative with his ways. And I have this conversation with his children sometimes. I'm like, man, I feel like he kind of had to be, because those are days where like if you make a mistake, that might set you back months. If you make a financial mistake, or you miss an opportunity or something like that, those are that generation right there is the type that, hey, we got to be up at 5 a.m. and we got to be ready and prepared for any and every opportunity that might come our way. You know what I mean?
Yeah.
And like it's not so much like that anymore.
Yeah, and I don't feel too far removed from that either, because like my dad, born here in Brownsville, was raised throughout his childhood in Monterrey, and I never got to meet my dad's dad, but he had about 4 to 5 businesses and then lost it all, and that's when they had to go back to Monterrey to like kind of restart over. So my dad kind of got to see the best of it, the worst of it, and then he had to build back from that. and he lost his dad at about 16 or 17, and so he kind of didn't have that like guiding father figure for a while there. So he instilled a lot of that in me, or like he made sure I was aware of that, potential where it could just like go like all away.
Dude, that's crazy.
Yeah. And so like I wouldn't even know, like, I mean, I always think back about that, like, one, I don't know how he like what it would be like to like, and I know he's not the only one, but just in general, like having to go through like your late teens, your early 20s, bringing in your first children to the world without your dad there, like that just seems like so hard. But I know he did it, and so many others do it, and kudos to all those guys that do it.
Yeah. So before we started, you were talking about what happened. You said you got off all socials during the pandemic.
Yeah. So when the pandemic hit, it was really stressful just being in healthcare. My hat's off to all the nurses and doctors that were working in the hospitals, because I couldn't even imagine what that was like. But in the clinic setting like we're in, it was just incredibly overwhelming, because you get, at least in the experience that I had, it was 20 to 30 different people every single day reaching out to you because they do not know what to do, and they're just trying to like stay out of the hospital and trying to not die. Mm-hmm. And like, the message might say, hey, just tested positive for COVID, what should I do? But the underlying message is like, how do I make sure I don't die? Mm-hmm. Right? Because that was the narrative that was being shown across the media, is like, all the deaths and the death toll, revving up and whatnot. So that was a lot of pressure, because there was no like real scientific data out in those early days to like know how to guide people. Like what the hospitals were doing was not working. What we were doing in the outpatient setting was not working. And it was just like slowly waiting for science and data to catch up, but it just wasn't. And then you had, kind of the polar opposites of COVID in general, where you had people who were just like super, like, I don't want to use the wrong terms here, but they were their goal was nobody should die, right? Which is not the right goal in my opinion, because you just can't control that many factors. And then you have the other. And
like, what category of people were those? Were those doctors that feel like nobody should die?
I mean, yeah, it wasn't like really based on. It wasn't categorized based on what you did for work. It wasn't categorized based on politics. It wasn't categorized based on faith or religion. But there was just from my view, from what I was seeing, it was like there was people who you just absolutely shouldn't leave your house.
Yeah.
Right?
By any means necessary, nobody should die.
Yeah. By any means necessary, nobody should die. And then there was the other side where it's like, it's all a hoax, this is fake, and et cetera, et cetera, et cetera, et cetera. And it was very hard to be in the middle, and that's where I felt I was. Like, I could see their perspective, but I could also see their perspective. And I think there was bits to take from each side.
Yeah.
But being in the middle on social media during that time, you get annihilated. If you're on this side, you get annihilated by this side. And if you're on this side, you get annihilated by that side. And at that time, my wife was pregnant with our first child, and I kind of just wanted to put all my focus on that, and I wanted to be mentally ready when she got here. And probably about 2 months before she was born, I sought therapy for the first time in my life, and it was really just like, I just want to make sure I'm in a good headspace to bring in a kid. Mm-hmm. That was how it started, and it unearthed so much past trauma that I didn't even realize that I had. I never would have labeled myself as a traumatized person. Mm-hmm. But once you start kind of, peeling the layers of the onion back, you start to see like, oh, like I've just masked and covered up all this trauma, and you start kind of getting a better understanding of yourself. And that is a painful process. And then being in that painful stage to then try to be on social media, I was just like, no, I can't. So I backed off social media. I was really only on Facebook, for the clinic, and wasn't really on Instagram or Twitter or anything like that, but really just kind of pulled away. Just like I would just go to work, take care of people, go home, take care of my daughter, take care of my wife, and that was that. And it wasn't until like basically maybe started 23, late 22, where I was like, all right, like I got to get back, out on social, because I think what we're doing is pretty important, and I think it's worth sharing.
Yeah, which I'm excited to get into your story and everything you're doing. It's super interesting, and I've always thought from a kind of regular, average civilian, really kind of I don't want to say completely uninformed, right? But this outside perspective, I'm not in the realm of healthcare. I'm not in the thick of things on a daily basis, right? From an outside perspective, I've always just generally thought like, man, there has to be an alternative. There has to be a better way. I'm sure many people think that, but when it gets down to the practical details of pursuing alternative methods, I don't have really detailed answers for that. But before we go down that route, since you mentioned it, I just want to ask. 'Cause I'm super curious now, looking back in retrospect on everything that happened during that the COVID and stuff, and now that you're back on socials, do you have any thoughts about that or opinions coming out of it,
About the hiatus I took from social?
like what do you think, like okay, let's say if you got that text or that message again today, right? Because I think people are still testing and still getting
Yeah.
positives. Hey, I just got tested positive for COVID. What should I do? You get that message today. What would your thought process be, and what would you tell that person?
It really just depends on who's messaging. Right? Like last week, we had a 25-year-old young, healthy guy text that he was positive for COVID, and it's like, and you can tell he's like, hey, like I'm good. What do I need to do? What should I take, and so on and so forth, and that's that. Back then, the texts were, instead of that one text, it might have been 5 texts back to back.
Yeah.
All with a different message. But if it's like a 70-year-old or an 80-year-old, I'm a little bit more concerned.
Yeah.
Right, because as we age, there's 4 main killers of people in the world, and that's 3 different chronic diseases and then infections, right? And COVID was one of those infections that 2020, 21, 22, like you would see, the older you are, the higher the risk of death, right? And like pneumonia is, I think, the 7th leading cause of death, and it's just like infection, right? It kills a lot of the older people. So if it's that person texting me, I'm a little bit more like, okay, what are your symptoms? What's going on? How long have you had them? This is the treatment I recommend. This is what we need to do. And I might even do 24-hour follow-ups, just like, you okay? You okay? You okay? You okay? And make sure that they don't need to go to the hospital, keep them out of the hospital, adjust treatment as needed. But even for them, they have an underlying sense of like, okay, the likelihood is I'm gonna be okay, but let me just reach out to us and see what we can do. Where back then it was just like you could feel the fear coming off the screen.
Yeah. I remember in those days, kind of just my mental approach, right? What I was already strategizing, because I was like, man, if this comes to my house, if this comes to my door, this is gonna be, and it was more of like an individual strategy. I was just kind of assessing where I am, right? I'm 35, I'm young, I'm healthy, I eat right, you know what I mean? And it's a flu strain, and so if it comes to me, I'm just gonna go into overdrive. Like whenever I get sick and I feel like really down, I immediately cut a whole lot of things out of my diet, like breads, refined flours, sweets, and all that stuff. I go like on all water and a particular kind of water, right? Like I'll put like some salt for electrolytes and like lemon juice and all that stuff. Start maybe juicing. That's what I do, and like I usually don't stay sick for long.
Yeah.
I usually get out of it real quick.
Yeah. So there's we could go off on that. Kind of just being like all the refined sugars and sweets and starchy carbs and all the things that we don't need to eat, but we do eat on a daily basis. I mean, that's kind of like the crux of, starting down that path of like, oh, your sugar's a little high. Oh, you're pre-diabetic. Oh, now you're diabetic. Oh, you have high blood pressure. Now your waistline's growing. Now you have heart problems. Now you've had a heart attack. Now you have heart disease. And before you know it, you're 60 and you're taking 10 meds and you just don't know where it came from, and it's the food that we're eating.
Man, that's crazy. And it's crazy you say that, because a lot of people in the medical field, it seems like I don't know if you take any amount of hours on nutrition or is there classes on that? Did you?
I mean, we had very little education on nutrition, through school. I remember having classes like specifically on nutrition.
And just real quick, so the audience knows, you're a
nurse practitioner.
Nurse practitioner. Okay, that's what I thought.
Nurse practitioner. Yeah. So I've been in healthcare working since 2012. So this will be my 11th year in healthcare, and then I think I'm on my 7th year as a nurse practitioner. So I got a good amount of experience under my belt now. I'm just going to kind of reference what you were saying about like healthcare professionals are saying like they don't get a lot of education on nutrition. Yeah. And the educational model for a nurse practitioner is very different than a PA or an MD. Where they kind of focus strictly on disease for the most part, at least historically. I'm not sure what programs are doing these days since I've been out of school for 7 years. While nursing, looks at the whole person, you know, from their emotional health, their mental health, their nutritional health, and their physical health. But even in that model, like the amount of education we got on nutrition is nowhere near what it needs to be by any means. And so a lot of my education on nutrition has come from seeking it out myself post graduation, looking for health coaches and learning from what they teach me to help me, you know, be in the shape that I am. I'm currently down 45 pounds over some years now. So I used to be a lot more overweight. I used to have a higher body fat than I should. Now my body fat is normal. My waistline was larger than it should. My BMI was higher than it should be. And like I could have done nothing. Like by cultural standards, I look pretty healthy.
Yeah.
You know, culturally right now, a lot of people think I'm too skinny. But if I had just stayed there, eventually I would have been increasing my risk for chronic diseases as I age, right? And so my goal was reverse that, get into the body composition that I need to be so that I can live as long as I possibly can.
Nah, dude, I think you look good, man.
Thank you.
I've seen, I mean, your photos on Facebook and stuff, and it seems like there has been a progression.
Yeah, for sure.
And I think it looks good.
Appreciate you.
So one last thing too is also different. Really curious about it. So during that whole time, too, back to the whole COVID thing, did you see all like I would say the controversy and you know, because there was a lot of people talking about it. Like I think one of them was Dr. Rashid Buttar. He came out, I think, on CNN. And it was very controversial. And then did you see and this guy was a highly, what's the word for it? Highly credentialed doctor, Robert Malone. You saw that thing?
Yeah. So I saw a few things on Dr. Malone. Go ahead. Just kind of finish your thought.
Well, that was kind of, I just quite, like, what were your brief thoughts on that?
I believe Dr. Malone was kind of like, he was like against the COVID vaccines, right?
Right.
Right. That was kind of the mainstay. I'll say my opinion on the whole thing has shifted a little bit. You know, back then I was saying that the COVID vaccines were probably one of the biggest medical breakthroughs that we've had in a very long time. I still think that that's true, but for very specific people. I am pro COVID vaccine if you're a high risk individual. If you're not a high risk individual, you probably don't need the vaccine. So I think that we kind of approached it from this blanket statement, and I kind of get like the whole herd immunity thing, and I understand that argument. And I think for people with chronic diseases, the elderly, people who are overweight, which just happens to be a lot of the population, like I think they would have very little risk of harm from the COVID vaccine.
Yeah.
I got the COVID vaccine myself. I never got the boosters after. Because when I started looking at the data, I started making that decision based on what my real risk was and making that healthcare decision in conjunction with the person that I see for my healthcare. And that was the approach that I started taking, and that's the approach I've always taken with anything, high blood pressure, diabetes, whatever it may be. It's kind of like, okay, we have to take all this information and we have to make it apply to you, how you live your life, what your family history is, and based on your current behaviors. And then we make that decision like, do you want it, also based on your preferences, do you want to have the vaccine, do you want to take the vaccine, or do you want to forego it? Do you understand the risk? If you understand the risk, my job here is to coach you through that decision, not make that decision for you.
Yeah.
You know what I mean?
I like that. I agree with that mentality. And I just, you know, stepping outside from that particular topic and just looking at healthcare in general and maybe our culture and society in general, I think it's very unfortunate that we can't just have civil discussions about these types of things without people getting very emotional, right?
Yeah.
Getting very frustrated about it and starting attacking your perspective and, you know, your ideas about that stuff, because, you know, I remember Robert Malone talking about that, and you know, I want to say people more from his field maybe were attacking it, and then people, not too many people, at least what I saw on, you know, the socials and stuff, were really commenting too much negative things here and there, right? But generally,
I mean, it's worth listening to the other person's argument, you know, and that's, I think one of the lost art forms of today is debate. Like
debate
it's so
is
hard
awesome.
to have a debate, you know, like you can't just like, you can't it's very rare that you'll see somebody like argue their point, listen to somebody argue their point, and then mutually disagree. Like, hey, okay, I get you, I just don't agree with you, and then still be amicable after the fact. Like now it's just like, nah, the hell with them, and like, et cetera, et cetera, et cetera, et cetera, et
But you
cetera.
know, if you're open minded, and I mean open minded in a healthy way, not open minded like, oh, I'll just receive anything and I'm cool with everything. No, I'm open minded like you actually hear what the other person is saying. You dissect it, you digest it in your mind, and then you say, you know what, you have some good points, not just completely closed off from what they're saying. So I'm talking about that type of open minded. But if you
Yeah.
are open minded, oftentimes you'll find like, you know what, I agree with like 60% of what this guy is saying, and I disagree with this 40 or 80, and I disagree with that 20.
Yeah.
You know, like usually you're not 100%. No, I completely disagree with you, and you completely disagree. You know what I mean?
Yeah.
Like usually there's this mutual level playing field, and to me that's very interesting because it's like, all right, man, we agree on 60% of this stuff, right? So really, all we got to do is really find some compromise with this 40% or come to agreement on this 40%,
Yeah.
you know?
Yeah.
And like, oh my gosh, if people would just relax
Yeah.
and become more open-minded and do that, it's like, man, I feel like we could make huge strides.
Yeah, we could. It's a lot easier said than done, unfortunately. But yeah, I just feel so many people just kind of talk past each other nowadays when they're, debating or arguing with each other. Like, person A is making a particular point, and person B is making a different point, and they're not even arguing each other's points. They're just like constantly trying to prove their point without understanding the other person. So, yeah, and then you translate that to social media with all the voices in the world, and it became too much for me in 2020.
Yeah. And I bet it's too because most people, and Joe Rogan has made this point, and it's so true, man. Most people live, the regular lifestyle is that, that 9 to 5 job. You work up, you have your kids, you go to work, you have to be, engaged at work. You come home, you're tired, but maybe you have your family obligations. Maybe you take the kids to practice. Maybe you come home, you get ready for dinner, and but the point is, you basically have a small window of opportunity for yourself where you can really maybe look at the things going out there in the world and see what's going on and figure out what's going on, and it's hard. And so you really have to defer to the leaders in whatever field, right? So I mean, if you have law issues, you defer to a lawyer. If you have health issues, you defer to a doctor. Whatever issue you have, you defer to somebody who's knowledgeable in that field. And I feel like we live in a different day and age where these leaders that we defer to for this information, at some point or some level, that the information has become compromised, whether it's people that are giving out this information that have these ulterior motives or whatever it may be. It's like, man, now you can't really trust that information. So I think these people that are coming to these blanket conclusions and making these blanket statements saying I reject you altogether, I think it's because I think the term they use for it is it's like cognitive dissonance, I think is one of the terms they use for it. But it's basically like, man, I don't have time to even begin to start to believe you because it's kind of scary. It could be scary.
Yeah.
Because if I just start to believe you,
Yeah.
that means I have to start to take responsibility for what I'm thinking and what I'm doing, and I might have to go and do my own research and like change things about, and it's,
Yeah.
for one reason or another, it can be scary,
And narratives and ideas are very powerful. So it's not like you're grappling with some super simple topic or super simple part of your life. Like, these narratives and ideas are kind of what we see and hear every day. They affect our lives, they shape our lives, and so on and so forth. One of my favorite quotes is, "We're only as good as our incentives." And I think if you just kind of start looking at whatever you want to look at and just start following, like, okay, well, what are these incentives behind all this stuff? That's where you'll kind of see like the real truth. And that's the approach that I've taken with healthcare, like particularly with insurance companies and like what their incentives are and whatnot. And that's my bread and butter. That's where I can go off on 1,000 different tangents. But yeah, just kind of looking at the incentives and then trace it back from there.
Yeah. So let's go into that. I guess describe what you do and your business and
Yeah.
and how it's different from, I guess, traditional or mainstream healthcare or whatever.
Yeah, so we run a clinic with 2 locations. The model that we use is referred to as direct primary care, or DPC for short, or direct care for short. And essentially what it does is it eliminates insurance companies, who we refer to as the middleman. And what our model of care does is it's basically membership-based healthcare. And that membership is going to provide about 90% of all your healthcare needs, and the 10% that it doesn't provide are things like treatment for cancer, emergency surgery, motor vehicle accidents, all those kind of like catastrophic type issues that might come up for somebody in their lifetime. We provide wholesale labs, so like checking your thyroid is $3 with us, or it might be $85 most places. We wrap all our procedures into the membership, so stitches, if we need to drain a cyst, if we need to drain an abscess, if we need to give you injections for pain, or you're super sick and we need an IV, or you need an antibiotic injection, strep, flu, and COVID testing, all that's wrapped in there. We wrap in virtual specialists. We even have free medications now. And what we do is we kind of limit how many members each clinician can have. So we primarily are incentivized by making the whole experience as convenient as we can for our members. And we can do that simply by just not accepting insurance.
Yeah.
Right? You can have insurance and you can be a member. We're just not going to be billing your insurance. Right? So when you bill insurance, that's the model called fee for service. And in that model, you get paid for doing things to people. In our model, we get paid for doing things for people, which is a super big difference in incentive, because if you have to do things to people, then you might start ordering tests that aren't needed, prescribing treatments that aren't needed, doing things in general that aren't needed, because that racks up what you can charge the insurance company that you ultimately get reimbursed for. And now, from my experience, a lot of these visits at traditional healthcare offices are becoming like, what's the most that we can rack up in charges versus like, what's the best thing we can do for the patient? There is a little bit of that, don't get me wrong. I'm just saying it's not the primary incentive if you really dumb it down. And one of my favorite examples is this, is like if I open a lemonade stand and I go to some big lemonade company and they say, hey, don't worry, we're gonna give you all the lemonade mix, we're gonna give you all the water, we're gonna provide you all the cups, we're gonna provide you the gallon, we're gonna provide you the table, we're gonna provide you with the sign. We're even gonna get people to come to your lemonade stand through our agents. It doesn't really matter what kind of lemonade I put out, because it's just a big circle. It's gonna keep funneling, right? Versus if I say, hey, you know what? I'll make my own lemonade. I'll make my own table. I'll make my own sign. I'll do things the way I want to do it. I'll make the lemonade with my recipe. I have to make sure now that I'm putting out the best lemonade every single day. Otherwise, nobody's guaranteeing me return customers.
Yeah.
Does that make sense?
That does make sense.
And you see how like that difference in incentive and perspective just ultimately changes the level of service you're going to provide, or the level, or it improves the quality of the product or the quality of the service, whatever it may be.
Yeah, I mean it's pretty obvious that it's a different method and approach towards healthcare, but to go a little bit deeper into the details, in the fee for service structure, like, is it almost, would you consider it kind of like a, I don't know if you would call it like a business transaction, right? But money is being, there's a monetary incentive for the doctors. There's the middleman, who's the insurance company, and then so it almost is like that, right?
Yeah, that relationship is very transactional. You know, and you can see it too, because it's like, yeah, some places you don't have insurance, they don't accept you. You have a balance, they won't work with you. And they put all these limitations on your transactions, and they won't service you unless they get you into a position where they can generate a transaction. And so like if I have health insurance and I call up a standard office and I'm like, hey, I need a refill on my blood pressure medication, they'll tell me, oh, you have to come in.
Mm-hmm.
Right? And they want you to come in because that creates a super bill from the visit, which then they can bill the insurance company so that they can get you your refill.
And in that structure right there, the patient isn't even necessarily he's not really what would it be, not the consumer. It's like the customer.
Correct.
It's like the insurance company is the customer.
Yes, exactly.
So it's like the doctor is not interested in necessarily giving you the best service, because you kind of don't even matter. The only thing that matters about you is whether you have insurance or not.
Yeah, and then how they can generate a super bill for their interaction.
That's crazy.
It is. It's Yeah, it left me speechless the first time I realized it too.
Yeah, and this is not the first time I realized that, I feel like there's a lot of areas within American society that is like that.
Hmm.
That is like that. But I don't want to go cast the net too wide and go into a lot of different areas and stuff. So I saw this documentary by Michael Moore.
Okay.
He was talking about healthcare. I don't know if you've heard of it, but basically he goes to all these different countries. He even went to like Cuba
I haven't seen this one, no.
for healthcare. He goes to Canada, he goes to Cuba, he goes to England, I think Great Britain and stuff, and he gets healthcare in all these different areas. And basically, like the summary of his point is like, man, America's healthcare kind of sucks. It's far behind or whatever. And he claims that he even got better care in Cuba, which that was kind of like controversial because they're like, yeah, well, he got good care, but he went because he had money and he went to the best doctors, you know what I mean? And the elites of the elites in Cuba could get good health care. But if
Sure.
you're talking about the traditional person in Cuba, they don't have it.
Yeah.
Their hospitals are horrible. You don't even want to take a camera in there,
Yeah.
Well, his point, but my point of that is that he went to England, and the structure that you're talking about, as far as the direct primary care, seems to be similar to what showed on that documentary as being like a great bit of healthcare. And I remember they did a doctor and they asked him, hey, how do you get paid, the doctor? And he says, I have a set salary, and then there's certain, like, I don't know if it's like commissions or bonus structures where I can reach those bonuses depending on how many patients like stay out of my office or how many patients I can actually get well.
Mm-hmm.
So the incentive for me is to get the person well, right? Because there's a monetary incentive associated with getting that patient well. And I'm like, man, that's how it works.
Mm-hmm.
But here in the United States, it's almost like the opposite. It's like if the patient could stay sick and keep coming to my office, and then I could bill him for all these fee-for-services and rack them up, that's how.
Yeah, I mean, I'm not too familiar with Great Britain's setup. I know that, I believe it's Canada, they have a setup where, it's a capped salary. Like, say a cardiothoracic surgeon has a capped salary, and once they meet that salary, they don't make anything more. The problem with that is, like, if they meet that salary in 7 months, they can choose to not work the last 5 of the year.
Mm-hmm.
You know what I mean? And so now that creates, somewhat of a shortage. I'm not sure, like, to what depth that is affecting Canada's healthcare. I hear arguments for Canada being great at healthcare, arguments for Canada not being great at healthcare. But that's just kind of one negative to that style. The other thing too is, like, yeah, I mean, when you talk about Cuba and getting healthcare in different parts of the world, there's a lot of factors to consider. One, two, a lot of Americans travel for healthcare now. They'll go to different countries because they can get treatment cheaper. Like,
I heard there's like a whole industry for that now.
Yeah, it's a huge industry where, like, you'll get American patients flying to Germany to go get chemo over there because it's like 90% cheaper.
Yeah.
Right. There's even certain drugs that here they might be $10,000 and somewhere else they might be 10. You
Mhm.
know, there was an idea that I had, and it's just slipping me right now. It'll
What?
come back to me a bit.
Okay, well, until you remember it, so let's go deeper into that fee-for-service structure. Why do you think it's structured like that? Because a lot of times I'll find a lot of answers, and especially in regard to situations like this, if you kind of just follow the money. So in the fee-for-service, a bill is racked up for the doctor, the insurance company pays for it, right? But I'm sure that the insurance company knows that that's happening. Why? I don't, there has to be more than like just them involved, right? I'm thinking there's probably pharmaceutical companies that are associated with that, right? Because they're selling their subscriptions, their medications.
Mm-hmm.
I'm sure maybe there's medical hardware providers if they're doing surgeries and stuff like that that are doing, and then there's probably stock associated. There's probably stockholders. There's probably, you know what I mean? There's investors and stuff like that. I know there's lobbyists. I mean, it probably goes deep and stuff like that. But
Yeah.
what do you know about that? Like, why? Because it just doesn't make sense. If you're looking at it like, hey, look, they're getting all these fees. They're not getting the best healthcare. If you just look at it like that, like, it doesn't make sense.
Yeah. and
What's going on? Yeah.
Yeah, this actually kind of rejoggled that what I was going to say. America spends the most money on healthcare, and we are not even ranked in the top 10 of developed countries. We're somewhere in the middle. I think we're 13th out of the 13th most developed countries in the world. I'm sorry. And then when you go back to like what are the incentives and stockholders and all this kind of stuff, I don't know like all of those inner workings of what's going on. I'll say that I used to think that healthcare was broken in America. I now think that healthcare is working exactly how they want it to work in America. And you've seen some of the top companies kind of shoot up the Fortune 500 list because of that. And I think that one of the primary reasons for that is because when you have such big business and you have these corporate institutions, as much as people want to help people, like as much as even people in the higher up positions in these companies probably do have a moral duty to want to help people, and like they feel that and they really think that they're still working within a system that ultimately cares about getting their shareholders their money back.
Yeah.
You know what I mean? And so no matter which way you slice it in that scenario, the patient's never number one.
Yeah.
You know what I mean? They're probably not even number two.
Yeah, and when you say that's the way that they want it, healthcare, who's they? The corporate institutions?
Yeah, whoever is making those big
The
decisions.
shot callers up there?
Yeah, I mean, I don't know how deep that rabbit hole goes, and frankly, I don't really care to know.
I can only imagine, because it's funny, and especially like considering something, and this is not regarding our topic, right? But one new issue in our government right now, right, which is the debt ceiling.
Mhm.
They're having that debate, right? And so I think it's interesting, just from the little I hear and glean from these little news articles, is that these sides are having this debate and they're trying to come to compromise on this bill, right? And let's say the Democrats and the Republicans, the Democrats is like, look, we can agree, but this has to stay in there.
Yeah.
And the Republicans are like, no, we want to take that out. No, look, we can agree this has to stay in there. I can only imagine that's how it works in healthcare, where it's like, hey, look, we could switch things up, we could put a pretty title on it, but we got to make our money.
Yeah, and like once you get closer to like real life down here where we're at, it's like, doctors, nurses, PAs, everyone, like they're all there. They're all, I mean, not all, 99% of them are good people, just really wanting to help people. They're just doing it from within a model that ultimately just doesn't service patients as number one. And so you get what's happening right now is insurance companies know that clinics are racking up charges to get a bigger payment. So the insurance companies are dropping reimbursements year after year. What they're paying out to the clinics is getting lower and lower and lower, meaning that doctors are now having to find more and more charges or see more and more patients, which leaves me and you kind of on the outside, letting them fight their battle, and yet we're getting sicker. We're the ones that are, our end of life is getting worse. Like somebody might die at 85, but what was their quality of life from 80 to 85? Were they picking up their grandchildren? Were they taking those trips that they wanted to take? Were they able to pick up their suitcase and put it on the overhead bin, or were they lying in a nursing home?
Yeah, one of the things I saw on that TED Talk is that end of life healthcare is like $1 trillion industry, I think they said.
Yeah, and most times, a lot of times people end up dying in the hospitals instead of dying at home like most people want to, around their loved ones, without all the beeping, without all the nurses and the doctors and, interruptions and so on and so forth.
And man, the stats around that are crazy. Like healthcare is like the biggest cause of bankruptcy. I think that was another statistic I saw. It's like the biggest cause of bankruptcy in the nation, I think.
Yeah, it's crazy because as growing up, you kind of see health insurance as like the adult thing that you do, and you, even now adults kind of see like, oh, I have health insurance, so if anything crazy happens, I'm good. But actually something crazy happens, like you're more likely to file bankruptcy than anybody else. There was actually,
even with healthcare.
Even with health insurance, yeah. It was
and
traditional
why is
health
that?
insurance.
Because like copay charges or what? Just charges that aren't covered?
Well, I'll give you an example. There was one gentleman who he had a very bad complication from a flu infection. He had a case of myocarditis, and I think he had a viral-induced heart failure. And he ended up going to the hospital, maxed out all his charges, maxed out his deductibles, still owed money to the hospital. And he was making payments. He missed a payment, and then the hospital sued him, which led to him filing bankruptcy.
Wow.
That's crazy, right?
That's crazy.
And he has health insurance. And like the articles say, like it wasn't bad health insurance. Like it was pretty decent health insurance. And so we view health insurance as this like crutch that we can lean on if something goes wrong, when really that's a lie. You know, based on if you look at the facts and the statistics on like healthcare or like some health crisis being one of the top reasons that a person would file bankruptcy, like, so then that's where I kind of led me to start asking the question, like, what's the point of health insurance?
Yeah. Like when you're doing a cost benefit analysis on whether you should get insurance, you're like, man.
Yeah, your return on that investment is low.
Yeah.
Is low in so many ways, you know, in that way, in the fact that like
especially the younger you are.
Yeah, and then like, so it's that way. It's like when you go into the doctor, when you get 7 minutes with them, you wait for 3 hours, you have to take a full day or a half day from work. You don't really make any connections with anybody. Calling a doctor's office is not a pleasant experience. Name me the last time you saw somebody that say, "Oh, I can't wait to go see my doctor today."
Yeah.
Everybody's like, "Oh, I got an appointment today," damn it, because they already know what they're in store for, right? So you get a low return on investment there. If you look at chronic care outcomes across the country, we're not in the top 10 in the world, so we get low return on investment there. You look at end of life care and you look at like, yeah, maybe we're living to 80, but 75 to 80 or 73 to 80 is not great quality of life. Low return on investment there. And it's because, you know, right now the way that healthcare works in the world, it's kind of on, it's too, in my opinion, and in the opinion of others, it's too lackadaisical on chronic disease, right? So like, we're more excited about saying, I don't, maybe not excited, but like, you can come into the office, right? And we can check your blood sugar. And it's like slowly going up, slowly going up, slowly going up, slowly going up. And it's, hey, but you're not diabetic yet. You're fine, you know? Just work on it, do a little more exercise, eat a little better. But then your A1C hits 6.5, which is the magical number that we then call it diabetes. And it's like, oh, hey, you have diabetes, you need metformin, right? Versus like,
you need what?
Metformin.
Oh, which is what, like an insulin drug or something?
It's a medication that makes your own insulin more efficient, so that it can better control your sugar. Okay. And most common prescription drug for diabetes. Whereas, like, in my opinion, I think we should be intervening way beforehand, and like we should be looking at different labs, not just your sugar, to see like how likely you are to eventually get diagnosed with diabetes. And if we see, hey, there's a high likelihood here, you're already on the road, your sugar might be normal on your blood work, but a different lab that we're looking at is high. It's like, hey, we need to intervene now. Mm-hmm. You know, not wait till like, oh, your A1C 6.5. Okay, now I need to see you every 2 months.
Yeah.
You know what I mean? And so it's just too lackadaisical, and I think that's why, you know, we have the outcomes that we have. And so when you operate outside of the insurance world, like I do, you can do all those things because insurance doesn't cover those things, right? Insurance only covers your A1C, you know, maybe once a year, and then if you're diabetic. But if you need to be looking at like, say, like insulin levels, or if we're gonna do oral glucose tolerance tests, they don't cover that stuff. There's no code that I can provide to an insurance company to get reimbursed for taking 30 minutes of my day to like sit down and teach you about nutrition and how to eat.
Man, and that's crazy because it seems like they're not concerned with keeping you well. They're concerned, they only come into the picture after you're sick. Mm-hmm. And it's almost like even when you get sick, it's almost like we're just gonna treat your symptoms, but we're actually not gonna get you well still. Man, and you know what? I'm so glad that there's an alternative for that. Like I'm glad we don't live in a country that they haven't cracked down on that yet, or they say, hey, no, this is what it has to be. Mm-hmm. It almost seems, and again, right, from this outside perspective, but it almost seems like that was the trajectory that they kind of wanted to go in when they passed the Obamacare, and I think they made it a law. Like there's a fee that you got to pay when you file your taxes if you don't have health care, that you have to pay some penalty fee for not having the health care or whatever. So it almost seems like that was a trajectory they want to go in, where you have to have this traditional healthcare type structure or you get penalized for it. So I'm glad that they have an alternative like yours. So do you want to go a little bit into like your pricing structure, and who do you think like the demographic that is good to get something like that? Because I think you've told me briefly, if I remember correctly, it's like $65 or to $80 a month for an individual, or maybe it's 80 for the family. I kind of forgot.
Yeah. So our pricing structure has changed a little bit since we last spoke, but we've added, you know, the virtual specialist. We've added free prescription medication now, and we've added a few other services in there now. So now our membership is $99 a month for an individual that's 20 years of age and older. For somebody birth to 20 years, it's $50 a month, And if you sign up like parent and child drops to $20 a month. And so that membership is going to, like I said, all your in-person visits, no copay. All your telehealth, no copay. All your procedures, no copay. All your labs, super cheap. Your medications, free. Your actual consultations are going to be 30 minutes to an hour, and we tailor that based on what you need, right? So like if you're coming in for nutrition, then we'll talk 30 minutes or an hour, or if you're coming in for mental health, then we'll set aside 45 minutes to an hour. If it's just a sore throat or you twisted your ankle or whatever, you get 15 minutes, and so we kind of incentivize it based on what the person needs per particular visit, and we're not putting caps on anything. And the amount of value that we're providing at that price point is unreal, because there's other models like this across the country, and there are others providing less than what we provide at a higher price point. So we feel really good about where we're at and what we're providing, and we feel pretty proud of like the fact that we were the first ones to bring this here to the Valley. Back in 2020, I think only 1% of all clinics in the country were doing direct primary care. So it's still a brand new idea.
And what was it that like you were like, that's the route I want to take?
Yeah, so I started out working out for one of the practices here in Weslaco, pretty big private practice, and at the time I thought it was amazing and whatnot, but I was booked every 15 minutes, 8, 8:15, 8:30, 8:45, 9, 9:15, 9:30, 9:45, 10, 10:15, 10:30, 10:45, 11. It didn't matter what the patient was coming in for. That's the amount of time of slots. That's the slot time I had with everybody. And granted, wait times for 3 hours. Even if you have an 8:30 appointment, I wouldn't see you till 11. Patients were frustrated. Then we started doing these things called like annual wellness visits, for just to keep it simple. Should take about 30 to 45 minutes, and I had to get them done in 15. And that's when I started to get burnt out. And I was like, I'm gonna open up my own clinic. Like, I can do this better, So I opened up my clinic, got credentialed with Medicare, got credentialed with Medicaid, Blue Cross, and slowly realized like, oh, like if I keep doing this, I'm gonna be the same way, So then I got hired, because I opened up my clinic part-time, and I kind of made that transition from full-time, night clinic, part-time, and then just kind of went full-time with my own over like a 2-year period. And prior to making the final jump, I was working with a clinic that was based out of San Antonio, has clinics here and throughout the country, and it's more corporate environment, and they promise that kind of like 30-minute reduced patient visits, right? So my first job, I was seeing 25 to 30 patients a day. Here it was supposed to be like 10 to 12. And then as I started spending more time with them, like 10 to 12 became 13 to 14 to 15 to 16. And it's not like they made more money when I saw more patients, and it's not like I got paid more money when I saw more patients. And it started to feel very much like the typical private practice that I was working at in the past. And so one day I was driving home from Brownsville, because that's where I was driving to work. And I was like, why can't healthcare just be as simple as going to the gym? You pay one monthly fee, you use what you need, and if you need something like a bottle of water or a towel or a sports drink or a protein shake, you just pay whatever it is, right? So I got home that day, and this was probably like end of December 2017. And I Google gym style primary care office, right? And I came across the model, the term.
That's a unique keyword.
Yeah, for sure. I didn't think I was going to get anything, but then I found this term, direct primary care, and I just went down the whole rabbit hole. I spent all of January reading nothing but direct primary care, like non-stop. YouTube videos as I drove, reading articles between patients. If I was waiting in for my food at dinner, I was reading about it. Like I was obsessed. And so then that was all January, February 2018. That's when I said, okay, we're dropping all our insurance companies, and we're just going to go with this model. And it was the first at the time, and I had a decent amount of support, but then I also had a lot of like, that's never going to work here, And here we are. We're actually a pretty big direct primary care practice if you look at the industry. 17% of direct primary care practices in the country make it past 600 members. The majority stay between 300 and 350, and right now we're at 900.
Wow.
Yeah. And it's just me and my wife right now.
Do you have any members that were part of your clinic before you transitioned to direct primary care, and like what do they say?
Yeah. We have a few, kind of like some of the ones that have been with us since day one. they, I mean, they love it. You know, they've been with us for 4 or 5 years now. They won't go anywhere. Some of them have gotten insurance along the way, and they still stay with us because they recognize the convenience and the value.
Yeah. And in a general sense, what do you think? What kind of patient do you have, right? Because I'm hearing the services that you offer, right? I'm 35, and I'm like, man, I can't really think of anything I would go to the doctor for.
Yeah.
I don't take any medications. Like, I really don't think I need, and when you're young, I think you're more like that. You're like, because, they might tell you, oh, you know what, at 35, you need to go check for this, and at 40, you need to go check for that, and you got to make sure, but I'm not. If I'm not feeling any type of pain or sensing any type of something that's unusual within my body, I don't want to go in.
For sure, I get that, and it's a really good question because that's kind of like what I've grappled with lately. Because now that we're at where we're at, I do want to take this to like 4 or 5 clinics, across the valley, with 4 or 5 different clinicians, and just because I don't feel like there's anybody who can't benefit from it, and I understand that there might be some bias there, or that there is some bias there, but just like looking at the hard data, I don't think that there's anybody that could not benefit from it. And so we can go from one side of the scale where let's just take somebody like yourself, right? Like, you don't go to the doctor because you're not sick, right?
Right.
That's fair statement?
Mm-hmm.
Right, okay. But folks in your situation would never think about okay, maybe I'm not sick, but how can I optimize how well I am?
Yeah.
Okay, and so
now that's interesting. That
Yeah.
piques my interest.
Right, and so if you think about okay, let's think about it this way. How do you see yourself living?
I feel like if there's not another world war or something like that, I see myself living well into my 80s, maybe 90s. I mean, my grandfather right now on my dad's side in his 90s, and on my mom's side, her parents, they passed away from, I think one of them was heart failure, but they were really poor and stuff like that. But they ate real bad, flour tortillas and beans. They were poor, and so I think genetically and the way I'm going, I think I could live into my 80s.
Cool. So when you see yourself at 80, what kind of life do you see yourself living? And I'll ask you a couple questions to kind of guide you here. At 80, do you see yourself going on hikes?
Yeah, I hope so.
At 80, do you want to be able to load your own luggage into the overhead bin on an airplane?
Yes.
Or even the idea of just boarding an airplane, because some people in their 80s can't board an airplane.
Yes.
Let alone pick up their luggage.
Yeah.
Do you want to be able to, how much distance do you want to be able to walk?
Well, I have it in my mind right now that I'm going to try to train and continue exercising and training as long as I live.
Right. So let's just, and then other questions, do you want to be able to play basketball? You want to be able to shoot hoops, play golf? There's so many things right, where you think of what are the core things that you want to be able to do at 80, right? Because some things at 80 are going to have to fall.
Yeah.
But there's core things.
Tackle football.
Exactly.
Maybe we're not playing rugby.
Yeah, maybe not rugby. But there's you got to look at that, right? And the best way to get there to where you live in that life is to start planning for that life at 35.
Yeah.
You know what I mean? And so looking at what you need to do to get there is how we would help a person like you.
Mm-hmm.
Right? And that's a different hat that I put on as opposed to somebody who has diabetes, right? Now for somebody who has high blood pressure, somebody who has a thyroid problem, somebody who has a diabetes problem, that's obvious.
Mm-hmm.
You need your checks every so many months, you need your medications, and you need a plan to get off your medications, right? A lot of people come to us because they want to get off their medications because they feel like everywhere they go, it's just here's your prescription, here's your prescription, here's your prescription. And one common thing that I hear from a lot of patients is they don't even put their hands on me anymore. Listen to my heart.
Yeah.
And my lungs, and touch my hurt shoulder.
Yeah.
Or touch my hurt knee. It's just it's this. Here's your medicine. Come back in 3 months.
And ballpark, what percentage of people do you think you've successfully been able to take off of medications that have come to you?
For the folks that come to me in the mental state where they know they're gonna have to put in work, and they come to me with that goal in mind, probably around 90%.
Yeah.
90%. Yeah.
That's awesome.
Because half the work is me, half the work is you.
Yeah.
You know what I mean? And so if somebody can engage in the work, then yeah, we can help you get off the medications pretty easily. That's not hard. So we've looked at your spectrum. We've looked at what I would call the common spectrum. Then we have this far end spectrum here, which is people with multiple chronic diseases, people who like you would literally call them they're sick. You know, maybe they have stage 3 kidney disease, they have advanced blood pressure, they have advanced diabetes, they have advanced pain or difficult to manage pain. Maybe they had a bout of shingles and they have chronic neuropathic pain, which is very difficult to manage. And these are the type of patients that you would typically see at like an internal medicine practice, but they come to us and we're happy to help them as well. So like we do it all. Like it really is quite a wide array of things that we do. You know, my wife, who runs our Westlaco location, she has gotten 4 different cases of cancer that got missed elsewhere, right?
Wow.
And so that's spectrum, right? And we're talking about like a 35-year-old with liver cancer who has a husband and 2 kids.
And let me ask you, was it a particular procedure that he did? Like, did she give him like a CAT scan or an MRI to catch it, or she just listened to what they were saying and came out like, hey, this sounds like that?
All of that, yeah. It's actually listening to the story and just kind of like understanding like, hey, this isn't your typical abdominal pain. Hey, let me do your abdominal exam. Hey, this is not a normal abdominal exam.
Mm-hmm.
This is not the exam of somebody who has gallstones. This is not the exam of somebody who has gastritis or heartburn or constipation, chronic constipation, or a stomach bug. This is different. I need to order the scan on this person.
Yeah.
And then the scan comes back showing masses, right? And so then we connect them with specialists, and even the specialists were just like, wow, like this is a really good catch. And thankfully that 35-year-old is still alive today, cancer free.
Man, that's awesome. You know what, on that note, so let me get on a like kind of a personal note. I will probably admittedly say that I have kind of probably a negative bias towards the healthcare industry in general, because well, I don't have any type of criticism or negativity towards, right? Because my mom passed away from cancer when I was 5, right? And they gave her the chemo radiation and stuff. But I don't, yeah, thank you. But I don't feel like, oh man, it's the healthcare, it's the doctor's fault. And then her sister, who is because it's kind of like on the women's side and my mom's side. Mm-hmm. And I actually read a magazine, and this is probably besides the point. I don't know if it was in Psychology Today, but it was some doctor who was doing some research, and he found like this genetic gene that comes from like Jews and like came down to I don't know, it's a long story, but basically I was like, man, that's it, because she said like there's a lot of Hispanic women, and it's only through the mom's side that they might carry this gene. And he was doing testing for it and finding it, and he was able to like kind of like prevent cancer in like whole families and stuff. It was super interesting. But anyways, yeah, my mom and then her sister got it. But then before that, my mom was pregnant with what would have been my older sister, and my sister was stillborn, or she was born stillbirth or stillborn. I don't know exactly how to say that.
Yeah, that's right.
And they end up finding out that it was medical negligence on that, and there was like a whole lawsuit about it, and we won. It took 13 years, went all the way to the Texas Supreme Court. It's in the law books right now. It was a major case.
Oh wow.
There was that, and so I've always been kind of like, I ask questions a lot, because I'm like, man, I want to make sure that they're doing the right stuff. So since I've had that mindset, I've caught a lot of like mistakes that like, and let me give you a recent example, right? When my wife was pregnant with my son and she went into the hospital, I remember being there one day, and I'm just there by her bedside, and she's there lying in bed and stuff. And I remember the nurse kind of like rushes in, and she's kind of like frantic or whatever. And she's like, she goes, your iron has dropped dangerously low. We're gonna have to do a blood transfusion. And she's like, and really, like, she starts like doing all this stuff, right? And so she tells her this, and then she leaves, right? She's gonna call the doctor or whatever. While she does this, I start thinking like, man, that's weird, right? Like nothing has changed, except the only thing that's changed is we came into this hospital, and now all of a sudden she needs a blood transfusion, you know? Mm-hmm. So I asked the nurse what medications they had her on, right? Because they had put her on some medications. They were giving her pills. For what reason, I don't know, right? So I asked her the medications, and I just like Googled the side effects. And I ended up finding out that one of the side effects of one of these medications was, I think it was pernicious anemia.
Okay.
And are you familiar with? So it's something that affects the B12, and B12 affects the regulation of iron.
Yeah.
Okay. So you probably know better than I do exactly what happens, but either way, it affected her iron dropped, and they want to do this. So next time nurse comes in, I said, hey, you know this medication that you have her on, one of the side effects is pernicious anemia or whatever. Like, man. She's like, oh, let me tell the doctor. So she tells the doctor takes her off that medication, her iron goes back up. Yeah. They don't have to do a blood transfusion. And I'm like, man, what are these people doing, you know? And I can only imagine that happens a ton, especially for the reason that I told you, that because a lot of times we're there with our family, we're regular average Joes, regular people, We don't know anything about the healthcare industry, and whatever the doctor says, that's best. We
Yeah.
trust the doctor, you know? And like you just stated in your experience at that other, right? You get 15 minutes with all of them. These doctors, I mean, I've seen doctors. Sometimes they won't even see you. The nurse will see you, take notes, and like leave. Sometimes they won't even see the doctor, right? But if you do see the doctor comes in. They have 5 to 10 minutes. They, you know, this quick question Q&A thing transpires between them and the patient, and then they're gone and stuff, you know. And it's like we don't exactly know what to tell the doctor. We're just trusting the doctor knows the right questions to ask, and they might not ask the right question because they're so busy, you know.
Yeah.
And so, yeah, that was my experience of that. And it, you know, if let's just say I did get sick, even if I got cancer, I probably wouldn't want to go to the doctor, bro.
Yeah, you know, I find that a lot in men, and like young men, and men in general. Like men really tend to put off healthcare, and I wish there was some way to kind of flip that narrative.
I think if they encountered more people like you, they'd be more open to it. Have you ever heard that
That's
quote?
a very kind compliment. I appreciate that.
Bro, it's so true, bro. Have you ever heard that quote? It's a good quote. It's an amazing quote. It says, "I don't care what you know until I know that you care."
Yeah. Yeah.
Bro, it's so powerful, bro.
Yeah.
It's so powerful. I can know that you're the genius and the best, and that's what I've experienced on a personal level in the healthcare industry. Yeah, you might be a great, amazing doctor, but if you have this sort of like apathy towards me or my family members, why?
Yeah.
I don't want to trust you.
Yeah.
You know?
Yeah. You want to feel that emotional investment from the person making or helping you make healthcare decisions. And I mean, you're not wrong in anything that you've said. You know, I think, you know, just kind of the flip side to it, and I'm not pro your argument or pro this argument. I'm just kind of like laying out different perspectives. There's so many patients to treat now with the growing population, and it's going to get worse. That means that all of this that we've already talked about, and like that cycle between the insurance companies and the clinics, it's going to get worse as the baby boomers, you know, kind of get their Medicare and whatnot. There's so many patients to treat now that, for better or for worse, and I would argue a little bit for the worse, we're using all this different support staff to do a lot of the tasks involved with the decisions coming from your clinician, right? So like, it's get all this in order, let me see it, I'm gonna make a decision, and then I need you to carry it out because I gotta get to the next person to go make a decision.
Yeah.
You know what I mean? And there's multiple factors to that, but you know, ultimately I think we're starting to see people kind of like, they're not even taking the time with me, like they haven't even like asked me anything. Sometimes the information that they have is wrong, you know?
Yeah.
And part of that is, you know, we're human, we all make mistakes, but yeah, you know, I mean, you know, kind of hospital medication errors, those are scary places to be.
Bro, isn't that like medical errors, isn't that like the second leading cause of death in the United States?
I'm not sure about in the United States, but I know it's up there. Or like, I don't know if it's top 3. I don't recall that fact right now. On a different day, I may have remembered it. But I know it's up there. And I was actually just going to say, like, a lot of people view like hospitals as a safe place. I view them as like a dangerous place.
Me too.
Yeah.
Again, right back to COVID, just using it as a quick reference. I remember during COVID, I was looking at my chances, my statistical chances of death if I got it.
Yeah.
And I'm like, okay, well, these are my chances of death if I get it. But if I go into a hospital, it goes up to like 10%, right? Because it was like 0.0 something percent.
Yeah.
If I go to a hospital, it goes up to like 10%. And I'm
Yeah.
like, I'm not going to a hospital. That was right, like, I don't know. That was
Yeah. So one of the arguments that I would, for the people that were truly anxious, like unnecessarily anxious about COVID, young people, healthy people, not overweight people, no medical problems, I'd be like, look, you have a higher chance of dying in a car accident than you do from COVID. And even that sometimes wouldn't get them to like calm down.
Yeah.
But if you think about it, like we get into a car every day.
Yeah. So let's go back to those type of people, those healthy type of people, and wellness care that you're talking about, right? And maybe you can use me as an example if you want to. I have a family of 5, and so let's say $99 a month it's $99 a month, right? It is what it is, right? But let's say I'm doing a cost benefit analysis, and like I explained to you, man, I hardly ever go to the doctor, so I don't really see the benefit.
Sure.
If anything, if I get sick and I need routine care, well then maybe I'll get it then. Um, is there anything that you think like someone, because I have an $80 a month MMA membership,
Mm-hmm.
you know what I mean? But I go to that a couple times a week and stuff. If right now the types of care that I would need, I got an injury when I was in 8th grade on my knee, so that's kind of like what is the word for it? Like the tendons and
Tendonitis.
no, but like doctors or that treat that.
Osteopathic doctors,
Is that what it is?
osteopaths.
Yeah. So maybe I
It's a
might
lot
need
of manipulation and
I might need like MRI. I might need stuff like that. Something I want. I don't have dental care.
sure.
I would like dental care. Maybe as I'm getting older, maybe my eyes or stuff like that. It'd be great if a doctor could tell me, hey man, this is what your blood work says. You know, maybe some dietary recommendations. All those things are types of things that I think I would recommend. I mean, I would benefit from.
Yeah. So like, I'll just use you yourself as an example. Like, you just made the comment like, oh, if I get sick and I need routine care, then I'll get the membership, right, or whatever. You know, get whatever service you want, even if it's insurance. That's the same frame of mind that has led America to be one of the worst countries, not one of the worst, but middle of the pack in terms of healthcare, because we wait for things to go wrong versus getting ahead of them. So like, you mentioned football earlier, so I'll use football as an example. For somebody like yourself, if you were to subscribe to the membership, I would become your proverbial quarterback for healthcare, right? And so my job then, based on what I'm hearing from you, is help you live as long as you can, as well as you can. And we do that in a variety of ways. We take a look at the 4 top killers of people in the country, which is infections, cardiovascular disease or microvascular disease, diabetes, and then cognitive issues similar to like dementia and Alzheimer's. And dementia is kind of classified in a bunch of different ways. So we start looking, and we can even do genetic testing on like how, what your risk is for dementia. We can look at different tests aside from just your A1C or your blood glucose to see like how far down the path are you in towards diabetes, and then do other tests that go well beyond your typical cholesterol panel to determine what your risk of heart disease is. And then we take a look at all that. You know, infections are infections, so we try to avoid infections, right? If we can keep you healthier, the less likely you are to die from infections. We take that, then we take your family history, and your family history kind of serves as like the future icebergs. Like if you're the Titanic, my job is then to steer you away from that iceberg with sufficient time, and then keep a lookout for different icebergs that might come up, right? Doing all that work year in, year out, year in, year out, year in, year out. And then you get to 80 and you're like, hey, I'm about to board a plane and I'm gonna put my own luggage up there, right? But that's the process. That's what people have to fall in love with. And I think most people, because of the narrative of healthcare and health insurance in the country, we're still, and I see this from men more than anybody, it's like, when I get sick, I'll go in.
Yeah.
You know what I mean? And when you get sick, it might be too late. Like, it might be cancer.
Yeah.
You know what I mean? It might be, like, sometimes people don't just become like, oh, I just turned diabetic. Sometimes people are crazy diabetic the first time they find out.
Yeah.
You know, and all these things are just slowly taking away at how many years you're going to live. And when we look at diabetes, when we look at microvascular disease, and I say microvascular because I'm talking about the heart and the brain, and then we look at dementia, you can funnel those down into some core activities that will help prevent all 3 or delay them, right? So like if we look at people who live to 100, they live to 100 by avoiding microvascular disease. They live to 100 by avoiding dementia. They live to 100 by avoiding diabetes. And they live to 100 by avoiding infections. And most of those people that live to like 90s or 100s, it's usually some sort of infection or microvascular disease that takes them out.
Wow. And in a general sense, you know, and I guess kind of going back to the fact that they don't teach diet and nutrition in college or whatever, what would be some general advice that you would say to, right, kind of like giving away free, giving people free value on this podcast?
For sure, yeah. I think to keep it super simple and like really actionable advice, 1, eat food at home more than you eat out is number 1, because you can control how the food is prepped. When you go to a restaurant, even if you go to a healthy restaurant, you can't really control how the food is prepped. You don't know what oils they're using or whatever other ingredients they're using. You know, you might get like this really cool, healthy looking piece of chicken that's covered in this sauce, and maybe that sauce is actually really bad for you.
Yeah.
You know what I mean? So eat more food at home than you do at restaurants. The second is eat meals that require a fork and a knife. Right? So let's get rid of the burgers.
Forks over spoons or forks over knives. That's a documentary.
I haven't heard of it, but you know, like, so let's get rid of the tortas. Let's limit tortas. Let's limit tacos. Let's limit burgers. Let's limit all those handheld foods and eat meals that require you to use a fork and a knife. And I always like to tell people that cutting your tacos doesn't count. All right, it has to be like real stuff that you have to eat, like chicken and mashed potatoes, stuff like that. Which is a segue into number 3, which is eat whole food, right? So like if it's in a bag on a shelf, probably not. And if you actually just go to HEB, if you just shop on the perimeter, you'll find all the whole food, like real food, potatoes, vegetables, meat, breads, dairy, milk, eggs, etc. Right? If you go down the aisles, that's when you start seeing the Takis and the hot Cheetos and the brownies and the cookies and the crackers and all those things that aren't real food.
Yeah.
So when you shop at HEB, shop on the perimeter. Try to limit your time in the aisles. And then number 4 is when you do eat out, eat half your serving. And you can either share the other half with your significant other or just save it for dinner later or for lunch the next day. Because most portions everywhere you go are too big.
Wow. And that's because I'm a big eater.
Yeah.
Which is probably why I'm probably about 20 pounds overweight, ideally.
Yeah, I mean, body composition is the thing that I like to look at. So like it's more so than just what's your height, what's your weight, or what's your BMI, which is a calculation of your height, weight. But then 2, like, what's your percentage of lean muscle mass? What's your percentage of body fat? What's your percentage? Well, I mean, really just your percentage of body fat and getting that back in, and then increasing your muscle mass, because increasing muscle mass is one way to help yourself live longer. Because as we age, we start losing muscle, and that's when we get very frail, and that's when we have a hard time keeping our balance, so on and so forth. And yeah, I mean, that's a whole different topic there, but yeah. Also, those are all types of things that we would look at.
So that's interesting. Even if a meal is healthy, eating half of it is better than eating if it's portioned, if it's over portioned or whatever.
Yeah, because if you eat too big of a portion, you're actually going to drive a really big insulin response, and that's going to fatigue your insulin over time, which is one way that you'll end up being diabetic.
And but the insulin response is only triggered by, isn't it carbs and sugars?
Everything that you eat will trigger an insulin response.
Oh, really?
Yeah.
So even if you eat like a steak, if it's too big of a steak, it'll trigger an insulin response?
I mean, so yes, I mean, even if you eat a 4-ounce steak, it's going to trigger an insulin response, because insulin's role is to take sugar in your blood that comes from the steak, right? Because your body converts that into sugar that your body's going to use. It's going to send it to your brain, it's going to send it to your muscles, all that stuff. And insulin is the thing that takes that sugar and helps guide it to where it needs to go. And so if you overeat, you eat too large of a portion, you're going to have an overload of glucose in your blood, and so you're going to have an overload of insulin trying to come in and help out. And it's just like, if you lift 5-pound dumbbells, you can do that all day. You get yourself a 50-pound dumbbell, and you're only going to be able to do it so often or so long until you fatigue out.
Yeah.
Same thing for your pancreas.
Oh yeah, and with insulin, if you overload it, then it can't do it basically. Yeah. All right. Well, I guess we can wrap this up, Michael. But thank you for being here. And if there's anything, how can people find, what's your website or?
Yeah, so the website is amenitydpc.com. That's AMENITY, D as in dog, P as in Paul, C as in cat.com. On Facebook, we're Amenity Direct Care. Instagram, Amenity Direct Care. LinkedIn, Amenity Direct Care. I'm on Instagram as Menchaca NP, and then Facebook, Michael Menchaca, and then LinkedIn, Michael Menchaca. I'm not too much on LinkedIn just yet, but yeah, I mean, it was a pleasure. It was a pleasure being here. Thanks for having me. Thanks for the invite. I thought it was a great conversation.
Yeah, me too. Thank you too.
For sure.
All right.